Most overuse injuries and sports-related injuries are readily treated with conservative treatment. Protection, rest, ice, compression, anti-inflammatories will help with these issues. If it's a sprain or a tendonitis, to mobilize that tendon for a period of time, allow it to recover, together with some anti-inflammatories and ice. Ultimately, doing some sort of physical therapy or something to retrain your ankle or retrain your foot to better accommodate the stresses. Most of the time, I will tell people that it's not necessarily that you have to stop your activity, but it's an activity modification. So focusing on upper body things, running, working on a stationary bike or something like that can allow you to recover and do something different. For sports injuries, one of the most common surgeries would be an ankle arthroscopy. So an ankle arthroscopy is when you use a camera and various tools to treat the pathology. Most of the time there is some sort of inflammation or synovitis within the joint that causes some deal of pain. There are a varying degree of pathologies that you can treat arthroscopically, like an osteochondral lesion, so basically a bone bruise to the bone, your talus, the bone in your ankle. If you have a piece of cartilage or a loose body, those kinds of things. They allow, good visualization of the joint, good correction of the pathology without a large incision. Other procedures are a lateral ankle stabilization. So most people in their life have rolled their ankle. Sometimes when that heals, it heals loose, and it's necessary to go in and basically tighten those ligaments back up so you're not constantly rolling your ankle. Tendon repairs, anything, tendons on the outside, your Achilles tendon, different procedures like that. So those are common sports-related injuries that I treat. I love working with patients. I think probably the biggest thing that I enjoy about my job is seeing patients recover.